Hi, my name is Cami. Welcome to Coast. I'm an EMR instructor here. We're going to be breaking down how to apply a Sager Traction Splint today. The Sager Splint is one of the more difficult skills for EMRs and PCPs to learn and also just maintain over time, but it's really important for pain management for our patients and also just to prevent further injury over time. So what is traction splinting? It's splinting with gentle inline traction to resist muscle contraction around the injury. Why do we use it? We use it to resist muscle contraction at the injury site, and what that does is it mitigates that fractured bone from being pulled and damaging muscles, nerves, and blood vessels around the area. And this actually provides a surprising amount of pain relief for our patient. When do we use it? In pre-hospital response, we usually use it for fractures of the middle third of the femur. We're only going to apply the traction splint once we've completed a thorough assessment of our patient. So what that means is we've completed vitals, we've established that we've got a pedal pulse, and we've administered pain control. So that could be Entonox, but that could also be Penthrox, and in this case, Penthrox might be more appropriate just based on the expected pain of our patient. And then also before we begin applying the traction splint, we're going to have our patient in supine. So we're going to walk through our acronym a little bit here. So we use the acronym STAPLES. Our S stands for size splint, which is essentially we're measuring the length of the leg and the splint. We have T for thigh strap. We've got A for ankle harness. P for padding. Just going to make things a little more comfortable for the patient. We've got L for load traction. E stands for elevate, but only if necessary. And S stands for straps. All right, so we've already exposed and examined the injury, and we've established that we have a pedal pulse. So then I'm just going to ask my partner to stabilize the site of the injury. And then we'll pull out our Sager splint, which looks like this. Because this is the injured leg, we want to have the dial pointing out away from the leg, so like this. And then we want to make sure that the top part here is also put on appropriately. So we want the bendy part on the bottom, but there's also a label on it that says Sager up, but sometimes that rubs off, so just remember the bendy part goes down. I'm then going to size the Sager. Okay. And I'm just going to ask the patient, I'm going to use a triangular bandage, and I'm going to ask the patient to just slide that up as far as he can and hold it there. So this just allows him to adjust it for comfort rather than me doing it for him. And then I'm going to size the Sager. So to size the Sager, we have this here, and so what we're going to do is just pull away, and we can make it longer or shorter as needed. In this case, I'm just going to pull it out a little bit, and I just want it to be about 3 to 4 inches away from the heel. So that should be good there. So that's me sizing it. The next thing I'm going to do is I'm going to apply the thigh strap. And what I'm going to do is just slide the strap under the hollow part of the knee. And when I apply this, I want to make sure that this strap is attached as high as possible. We don't want to be going right over top the injury. We want to go up as high as we can. And if the patient is wearing, let's say, belt loops here, we might even just attach it to the belt loops. But in this case, I'm just going to try my best to get this as high as possible. Once I've done that, I'm always just going to reassess my distal pulse and make sure that I've still got one, which in this case I do. We're good to go. So we've attached the thigh strap. The next thing we're going to do is attach the ankle strap, or the ankle harness. So I have my partner stabilizing the thigh. I'm just going to very gently lift the foot up so that I can get the harness underneath. And this strap here, I'm just going to loosen it all the way. Okay. When I apply the ankle harness, I want to make sure that it stays above the malleolus, which is the big bone that you feel right here. There's extra padding on this, so you're going to either leave it in or take it out, depending on what you find is better for a good fit of the harness. And I'm going to put it on quite tight so that it doesn't slide down below that bone when I pull traction. Okay. So I've applied the ankle harness, and I had loosened this before. I'm just going to make sure that I tighten that again. Okay, so next what we're going to do is just add some padding between the splint and the leg to make sure it's comfortable for the patient. What we can use is any bulky dressings or triangular bandages, so I'm just going to tuck that in. We don't want to use anything too bulky, like we don't want to use a blanket that is going to create too much distance. Just a little bit of padding in between. The next thing we're going to do is actually load traction, but before I do that, I know that this is a closed fracture, so I'm only going to pull 10% of his body weight, but only up to 15 pounds. In the case that this were an open fracture, then I would only pull up to 5 pounds. So in this case, I'm going to ask my patient approximately how much they weigh.
225 pounds.
So in this case, I'm not going to pull 10%, I'm just going to pull up to 15 pounds. So I've just applied traction, it's at 15 pounds. I'm going to reassess my distal pulse, and it's still good. So the next thing that I want to do is make sure that the splint itself is parallel to the ground. So right now you can see it's dipping towards the ground. We want to make sure that it's parallel. So you can either use the patient's shoe if you have it, or any object that can help you elevate that, and just make sure it's parallel. Once I've done that, again, I'm just going to make sure we're still at 15 pounds, and we've moved a little bit, reassessing pedal pulse. Okay, we're good. We're now going to attach the splint directly to the leg, and so we're going to use these straps. They come in different sizes, 32-inch and 24-inch. Just to get this in place, I'm going to, again, slide it through the hollow part of the leg. And I'm just going to slide it up. Again, working around my partner, we want to make sure we're still stabilizing as we go. I might have to fold this so I'm not going directly over top the brake. And it's okay to go over the actual handle as well. Are you good, partner? Yeah. And we'll grab another one. And we're just going to go just probably below the brake and below where my partner is stabilizing. Just wanting to avoid the joints like the knees. And then the last one is just going to go below the knee. And as we're doing this, again, I'm still making sure that I've got tension, so it's gone down to 10. I'm just going to make sure I pull again. Okay. And reassessing distal pulse. And it's good. And just attaching that there. Again, being mindful of tension and pulse. Alright, so we've attached the straps. The next thing we're going to do is just bring the legs together. I'm going to be gentle, very careful. You're going to bring in this other leg. Let me know if that's uncomfortable for you. And I'm going to grab usually a triangular bandage. I'm going to tie the feet together just to prevent any kind of rotation of the foot, just making sure that they're in line. You okay? And again, once I've done that, I'm going to reassess distal pulse. We're still good. And check traction again. Alright, now that we're at this point, my partner can now stop stabilizing. She's good to let go. And I'm going to grab a clamshell. We're going to lift my patient up like that, put them on the stretcher, and move into the ambulance. Again, reassessing ABCs and checking distal circulation and traction as we do that. Hope you found this skill video useful. Let us know what else you'd like to see.